So most likely if you're coming to check out this video, you have that heel pain that's absolutely horrible when you first wake up in the morning, or maybe after you sat on the computer for a few hours. It's a type of pain that when you go to stand up, it makes you sit right back down. Yeah, most likely it's coming from something called plantar fasciitis. So today we're going to quickly talk about what the plantar fascia is, what it does, some common myths with how to treat it, and some really good tips to get you pointed in the right direction, and even some ways to prevent it from reoccurring in the future. Okay, so what is the plantar fascia? Well, the plantar fascia is a connective tissue on the bottom part of your foot, starting from the heel, specifically the inside of the heel. So this is the undersurface of your foot. It runs all the way up to the toes. And if I turn this foot model to the side, it has continuous connective tissue all the way up into the Achilles tendon, up into the Achilles, and then into the calf. So what this tissue does, basically, it prevents your foot from dropping or splaying too. Okay, taking on a different view, if you look at the lower leg, as our body bears weight through the shin bone, your foot is going to splay. It actually lengthens. You have 4 layers of muscle which protect you and help you dynamically. However, the plantar fascia is a passive tissue. It doesn't contract and doesn't stretch all that much. So as you're putting weight down, the arch is basically being held up by this connective tissue and the 4 layers. So being that the 4 layers of muscle could be weakened, or maybe you have a quick sudden increase in weight, which could be something like wearing a very heavy backpack, maybe changing the sneaker that you're wearing and it's changing the force distribution in your foot, or maybe you even took a new medication that unfortunately had a side effect of you gaining an extra few pounds. All these things can bear a big difference in how much pressure this plantar fascia is dealing with. So basically, if there's a quick increase in stress, it's going to happen through the fascia because your body is putting weight downward, and it's going to pull typically at the point of the heel. Now, all of our bones have bone skin, something called periosteum, and that are very, very sensitive. So as this connective tissue is trying to stretch, which it can't, it starts to pull. It pulls so hard in some cases that you can get a bone. So a bone spur is a traction lesion, if you will, that your body will produce basically as a self-protection mechanism. The connective tissue that doesn't stretch pulls so hard that the body actually allows more calcium to develop, and it creates this spur-like shape that slackens the tissue in an effort to decrease strain. So sometimes you'll have a big bone spur on an x-ray and it looks very alarming, but most research will say that most bone spurs don't actually cause pain. It's just the inflammation around. But it's the point that that's how hard the stress is kind of born through the heel. So what we want to do is reduce that stress as much as possible. So we talked about the plantar fascia, the anatomy of it, and the inflammation of the plantar fascia being plantar fasciitis, and who's most likely at risk for it. So how do we fix it? Well, before we talk about how to fix the problem or work on preventative measures to prevent it in the future, there's some things we have to get off the table. We have to talk about the myths in the treatment of plantar fasciitis. So because this is the most common encounter physicians and medical practitioners will deal with related to heel pain, about 1 in 10 people get it, 2 million Americans are treated for it every year. There's a lot of different treatments for it. So here are some of the ones we see that don't work in our clinic. Okay, so we chose 4 myths that we want to completely avoid altogether. Honestly, because I think we slow down this healing process. So plantar fasciitis typically will last 5 months to 9 months, some people up to 18 months, and even as long as 5 years, we've heard of it. It could be bilateral on both feet, which could be incredibly debilitating. So I think the stuff we do to help is actually slowing us down and unfortunately leading our bodies to have to work a little bit harder than they should. So the first up is icing. Well, I should say over-icing. So let's say you were playing tennis on Saturday morning, you felt a sharp pain, and you continued to play a little bit. You felt it into Sunday and maybe Monday. That's truly an inflammation. There's inflammatory cells present. So taking Advil, anti-inflammatories would clearly help you with that. Not that I'm suggesting it, I'm just saying that's when it's going to work best. After that point, that itis, the inflammation of the plantar fascia, so plantar fasciitis, is really only a few weeks long, that time period. After that time period of like 2 to 3 weeks, maybe 4 weeks at most, you're moving into plantar fasciosis, and there's not truly an inflammation process there. So the inflammatory cells are no longer present. Therefore, icing probably isn't going to work. Icing typically will help with pain, but it can significantly delay healing because you're kind of slowing down your body's way of healing itself. So icing is okay in the beginning. I would say 5 to 8 minutes, no problem. But I'll clearly stay away from overdoing it. 30 minutes, 50 minutes, multiple times a day, hours on end. We hear that all the time. Just think about it. You're literally narrowing down the blood supply to the area. That blood supply, that very same blood supply is what's healing you. So you don't want to numb it up too much, especially if you're going to jump back up and do something a few minutes after. Because remember, when that plantar fascia splays or tries to stretch, it actually has mini cracks or micro tears. So your body will heal that within a few minutes, a few hours, overnight, and you put your foot back down again. If it's stiff, especially if it's cold and not warmed up, it's gonna pop again, and you're gonna have those micro tears take place again and again and again. This is just a negative cascade of events that happen for a long period of time. So icing, if done too much, can actually be detrimental. The next up is gonna be rolling your foot on a ball aggressively. There's nothing wrong with taking a ball or putting your foot maybe on a frozen water bottle perhaps, and just slowly, gradually relaxing or releasing some of the muscle tissue or tendons there. Not a problem. It's when you put too much pressure on the spot that's already upset with you, I kind of think you're asking for trouble that way. So if you're massaging the muscles on the inside of your foot, remember the plantar fascia is going to bisect your foot. You can massage the muscles on the outside and the inside, not a problem, even a little bit down the center. But when you're rolling your foot, put very little pressure. So something like 2 times a day or 3 times a day with a little bit of pressure, mobilizing and moving your toes or ankle while doing it can significantly help you. However, we've seen some pretty bad cases of people coming in from other clinics who put way too much pressure on it. And the balls that they're using are very, very hard. They're not soft or compliant, so therefore they can cause some problems. Things like lacrosse balls, for instance. Okay, next up. Third myth, you want to bust this one fast. You do not want to overstretch the plantar fascia. So I'll tell you what you should be stretching. Totally okay to stretch the Achilles tendon. It's a good thing to stretch the calf, the gastrocnemius and the soleus. That's the complex that makes up the calf. The muscles underneath your foot, no problem. Mobilize your toe, stretch your toe, no problem. Your ankle, encouraged, no problem at all. However, you don't want to overstretch the plantar fascia. It's already a stretch-related injury. You may be creating a stretch or traction-related spur. So why would you want to pull on it more? It doesn't need to stretch anymore. It's not supposed to maintain the height of the arch. So stretching it, overstretching it, probably isn't the best thing to do. Again, stretching other parts around it to take the load off it is a great idea. Fourth myth, busted. You do not need to have a super high, rigid arch to help with plantar fasciitis. Customized orthotics are very helpful in the short term, a few months to up to 12 months. It should not have to be a permanent thing. In 2019, they proved that a cortisone injection was better in the short term, but longer term, closer to 12 months and on, a customized orthotic was actually more helpful. So it's important to support the arch, not crush it. So if you're looking at the arch in this position here, you can see how the plantar fascia attaches to the bone and all the way up to the toes. Once it's in this position, if it's already taut and you're putting more pressure upward, it can create more tension in this spot right here. That's something you want to avoid. So a customized orthotic would be a really good idea because it's customized to your foot. It's not going to put too much pressure on one area. It can help align the rear foot, which is the back portion of your foot beyond the tibia. It may even help with the forefoot, which is the part of your foot in front of your shin bone. So a total contact orthotic that's customized to your foot may be helpful, but you do not need to go ahead and buy something that's going to be pushing so hard up into the arch and plantar fascia that it could potentially cause more pain. So here are 3 really important tips to help you start feeling better today. They're all very, very good. One of which is probably my favorite because it can prevent the reoccurrence of plantar fasciitis. Yes, it can happen multiple times in your life. So the most important one, and I'll have you take a look at this video if you have 5 minutes. It's basically how to assess if you have enough ankle mobility moving into this. So if your ankle is restricted, you're putting your plantar fascia at a very, very high risk for injury or re-injury in the future. So what you don't want to do is have a really tight, stiff ankle that forces your foot to splay every time you go to move. You want your ankle to move independently of your foot. Second tip, really, really, really important one. This one you should start like yesterday. Before you get out of bed, you must move your toes, your ankle, and if you have a few minutes, even move some of the muscle tissue before you put your foot down. Most of the tears, I believe, happen when you put your foot down right after being in a shortened state. This tissue is in a shortened state because it has nothing to act upon it, so it starts to heal. The collagen is laid down, scarring is laid down. It's not strong, it's very temporary. It's immature scar tissue, so when you put your weight down on it, I think it kind of breaks up a bit and causes the pain immediately. So what I really think you should start doing is moving your toe, moving your foot, moving your ankle before you get out of bed. So we'll go over this in some of the exercises at the end of the session. For now, what you can do is grab a hold of your foot, gently stretch your toes in the upward direction, grab your ankle, pull your ankle in the upward direction. You could pull your foot up, point it down. Anything you can do to get your foot to move for 30 seconds, a minute, if you have time, 2 or 3 minutes, will substantially help. And even when you do put your foot down, don't jump up out of bed. Put your foot down and rock forward and back. Partially bear weight on it. See if you can get your arch to move up and down a little bit. Stretch your toes lightly. That'll substantially decrease your pain and get your foot ready for the rest of the day. Next up are 3 effective exercises. Okay, so this stretch for the plantar fascia and the connective tissue behind the calf is going to be pretty easy. You're going to take a towel. You're going to fold it up about 4 times. You're going to come right over the foot and ankle. And when you apply pressure and pull, you're going to pull lightly. If you pull too hard, the towel is just going to slide. So what you want to do is make sure you're getting the toe. The big toe is connected all the way to the plantar fascia, which is again connected to the heel. So once the pressure is applied, you're going to feel the stretch in the calf, the Achilles, and all through the bottom of the foot. You're going to want to hold this about 20 seconds and repeat it 5 times with a break about 10 seconds in between. Okay, so for this next one, this is a great myofascial technique that you can do manually. We do it in our office, but you could do it to yourself. So this has been proven in research to work. What you want to remember is the connection sites of where the plantar fascia is. So if you're looking at the bottom of the foot, it's on the inside of your heel. So with her, this is the heel right here. We're going to try to focus our attention right here using the toe as a lever. So she's going to put pressure, that's your tack, and then the stretch is going to come from the other hand. She's going to pull up, increasing the angle of the toe and then increasing the angle of the ankle. We're going to hold that roughly 5 seconds and then return. She's now going to move her finger in a different place. You're trying to get all the muscle and connective tissue that follows the line of the plantar fascia. So about 5-second hold and then repeat. So the goal is to tack it first and then stretch on top of that. You're going to want to do both sides of the plantar fascia. It bisects the foot. So you want to do the inside and also the outside. And then you're going to want to finish up with taking both your thumbs and splaying gently the plantar fascia. This whole thing should take all about maybe 2 minutes, 3 minutes at most. Okay, so for this one, this is the ankle mobilization. This might be the most important one that you do out of everything. This could be the one that prevents you from getting future occurrences of plantar fasciitis, shin splints, as well as calf problems and Achilles issues. So what we want to do is make sure your foot is centered. Your knee is going to follow the second toe. You want to pretend that there's something sharp underneath your arch, maybe like a thumbtack, to prevent you from collapsing. Very, very important. So once you have your arch in a high position, your weight's going to be on the big toe portion right here, the little portion, and then the heel. So it creates a tripod. Once you're in this position, you're going to move your shin and knee forward, align with the second toe, without dropping your arch. So back up and come forward as much as you can. You can see there's no dropping of her arch. The goal is to move through the axis of the ankle. So forward as far as you can. If you feel a pinch in the front, that means you've gone a little too far and you have enough ankle range of motion. Most people struggle around 0 to 5 to 10 degrees. The goal with this exercise is to get 10 to 15 degrees because that's what we need for walking. And so after you repeat this, hold for about 2 seconds, you back off. I would say on average it would take about 1 to 2 minutes to mobilize the ankle, and of course you should do both sides. And once you have more experience, you can start to move the knee in the inward direction and the outward direction while keeping the foot still. So that would look like this. Just gets different parts of the ankle. And there should be no pain. Thanks for checking out our video. We hope you learned a lot. Now remember, it does not have to last 9, 12, 15 months. There are things you can start doing today that'll help the plantar fascia start healing faster. The unfortunate thing is when you do too much of the wrong thing or not enough of the right thing, you see some pretty bad results. You get frustrated. If this is you and you're having trouble, please let us know. We'll be more than happy to help and answer some questions. Have a great day and take good care.